most of these pillars are not working. Where you find problems, as I will show some red points in Ankole, you'll find that these pillars are not working. Service delivery is at the center. The reason why we are here, if you forget everything, is about service delivery. Service delivery for people who are not here. Ankole alone has a population of 3.5 million people, and Kigezi also almost the same number. So as Minister of Health, we are working very closely with Minister of Local Government to ensure we implement activities to improve maternal and child health, like QI collaboratives. There has been upgrade of health facilities. Some of them have not been functionalized. We've been seeing. We make sure that all the facilities have adolescent responsive services, procurement of ambulances and other services. There's also health financing, human resource medicines. This is an illustration of how the health system should look like. But for you to get something good in the middle, there must be all those 6 pillars must work together. If you have, like we've seen, I was somewhere I will not mention, if you have vaccines and the leadership is poor, they don't know that vaccines must be kept in a fridge at a certain temperature, they won't get spoiled. Even if you have money, if the leadership is poor, then you'll have challenges. Government has improved investment in all these areas: health information systems, leadership, service delivery, even human resource, including the numbers of health workers, including training them. But what we want to see is, are we getting something that matches this? At least there is some hope. And this slide is going to show us what are we seeing. Next. Over the years, I like this slide, but it also tells us that we need to do more. Over the years, from 2000, we have been very deliberate in counting how we are improving our maternal mortality ratio. And you can see that's the Uganda Demographic Health Survey for the last 6 periods. That's the last 30 years. It's done every 5 years. Currently, we stand at 189, and our target is 70 by 2030. That's how we want to go. Now, we have worked to move from 189 women who are dying per 100,000 to 70. 189 is not the only number that's dying. You might ask yourself, but 189? Because we are delivering around 1.6 million babies per year. So 189 is per 100,000. So it's 189 times probably 16. That's around 1,800 mothers who are still dying. And others are dying in the villages, like we had in Kazo, without being reported. Just before we go far, we also have, on this other side, you'll see we have done some good work. The number of women who are dying from our health facilities has actually come low. And we are happy with that, but we want to bring this one to less than 50 so that the population level could be less than 70. Next. I'll show you the picture of Ankole. That previous slide has been shown by my predecessor, the other speaker. Our investment in immunization has yielded results. Uganda achieved the MDG for infant mortality, reducing infant mortality. We are also on course to achieve the SDG for child mortality and infant mortality. And I think the biggest margin has been immunization. No one should distract us from that. The number of newborn babies also dying is coming low. That's a good indicator. And we think that with increased investment, now we are going to have a state-of-the-art NICU in Ankole region. We shall have more of these babies being saved. Next. This is antenatal care, and this is what we see at the national level. Our average antenatal one has been around 90s, so we've achieved the UN1 recommendation, but we need to make sure that they come on time. The ones that come in the first 12 weeks are very low, as I will show you in some of the slides. Skilled birth attendance has increased. We're now at 86, but I'll show you how the Ankole picture looks like. Because of time, I might only pick out deep dive in Ankole. Next. This is Ankole region, and that's the geographical infrastructure. I think you know most of these districts, and that's the population, 3.5 million people. Next. Yes, one of the hardest key points of pain or areas where we need to put our efforts, I picked where we had challenges, is that we have low HB testing. For our other leaders who are here, every pregnant woman, I did mention at the beginning that no woman should get pregnant by